for that introduction, Ronnie. It's lovely to be here with you on the Gold Coast. Can I start by acknowledging the traditional custodians of the land on which we gather, and I pay my respects to their elders, past, present and emerging. To the Australian College of Nursing President, Christine, I will try not to think of you as Sweet Pea now, but I think that might have stuck, Ronnie, and Kylie, who's your CEO, and to all of the fantastic delegates you've got here at the conference. Can I congratulate you and the college on the terrific program that you've put together. It's a huge program over the course of the next 3 days, and lots of diversity in both the topics and in the guest speakers. I've been particularly asked to mention your speed leading, which Kylie tells me is a cross between, or she described to me as a cross between speed dating and an Irish pub on steroids. So I'm not quite sure what to make of that, but I understand it's a really important part of the program. So well done to the college on such a fantastic program. Well, it's been a pretty interesting week in politics last week, so I thought I'd talk a little bit about that to start with. I've been in Parliament for 17 years, and I've seen my fair share of instability on our side and leadership ructions, but I haven't quite seen anything like what we saw last week. It has culminated, of course, in a new Prime Minister, and ultimately in politics, though, it's not really the personnel that matters, although they do make a difference, but it's actually the policies, and I think that's going to be really important as we go forward in the lead up to the next general election. And when it comes to health policy, we in the Labor Party do have a fundamental philosophical difference with our opposition. There are differences, those differences are not differences that are just going to disappear because there's been a change in the leadership at the top, and those differences will of course be a key battleground when it comes to the upcoming federal election. We're not sure when that's going to be, but potentially in the next 9 months. And we want to make sure, of course, that health is front and centre of that election, not just because it wins us votes, but because it actually is deeply important to the Australian population. It's core business for me, it's core business for the Labor Party, and it's core business for our leader, Bill Shorten. And of course that cannot happen without the work of nurses. I am very pleased to see the role that you are playing and the college is playing an increasingly important role in the space of advocacy when it comes to health policy nationally. When it comes to our health policy debates, we hear a lot from doctors via the AMA, the College of GPs and rural doctors, but I want to make sure that we hear from the college as often and as loudly. Nurses have also, of course, infiltrated the Parliamentary Labor Party. Since I spoke to you last, we've welcomed Jed Carney into our ranks, and I, for one, couldn't be happier that she's there. She brings a very valuable perspective, and she'll be a formidable advocate for nursing in our party going forward. All of which to say is that I think nursing right now is more an important part of our national conversation than ever before. And so today I want to outline a few things. I want to outline our vision when it comes to nursing for Australia, but I also want to touch on a number of the ongoing debates in healthcare that will shape and be shaped by the work that you do. In late 2016, the college was kind enough to invite me to help launch your white paper on the role of nurses in health and aged care reform. One of its key points was that we will all benefit if nurses have a seat at the table for every debate. So I do want to give you a sense of our thinking on some of those. It's reflected in the Labor Party's new draft policy platform, which, barring an early election, we were to have it a little earlier this year, but there were some by-elections that meant we've delayed it until December, will be enshrined as our guiding principles document. The health chapter of the draft contains an expanded section on nurses and midwives, which spells out our overarching vision for your place in our health system. It acknowledges that you play a critical role across and beyond the healthcare system, not just in the traditional domains of hospitals and aged care, but also in primary care, in prevention and health promotion, and other sectors such as disability care. It makes clear we understand the value of expanded education, training and employment opportunities for nurses throughout the healthcare system. We want to provide you with the clinical education, training opportunities and support you need to expand your role. We want to address existing and emerging nurse workforce challenges with particular focus on areas of workforce shortage. We understand that includes making sufficient university and vocational education and training places available to nursing and midwifery students. We want to drive national consistency in nurse workforce education and role utilisation and development to improve nurse workforce attraction and retention, and to build nurse workforce leadership capacity to support workforce development and health service reform. And we want to expand and support the primary care nursing workforce, ensuring there is an appropriate staffing and skills mix, and where appropriate, support the expanded role for nurse practitioners via access to Medicare and the PBS. I know that's an important reform for all of you. We agree that the Medicare benefits schedule does not yet properly value nurses. We're glad that nurse practitioners have been recognised in the MBS and can now access a range of items. But of course, these could be utilised better across our healthcare system. It was even only yesterday I had flagged with me the notion about when we're expanding and looking at expanding the role of GPs in primary care and in residential aged care. In fact, we should be talking also about the role of nurse practitioners in aged care to ensure that residential aged care recipients actually do have better access to primary care. We know that international evidence demonstrates that care by nurse practitioners can result in outcomes that are equivalent to and sometimes better than those achieved by doctors. We must ensure that Medicare actually reflects this. Of course, new or amended Medicare items are recommended by the Independent Medical Services Advisory Committee or the current MBS review, but I can assure you that a Labor government would be committed to working with you and those bodies to make the best possible use of the nursing workforce. In both primary care and in hospitals, we should do other things to support you as well. Primary care is the front line of our healthcare system. The stronger our primary care system, the better Australia's health outcomes are. Our primary care system should have a greater emphasis on protection, health promotion, disease prevention and early detection so we can start curbing our chronic disease rates. To make this happen, we need better integration between GPs, nurses, specialists, allied health providers and our hospitals. And that means, of course, developing new models of care. That's not easy and it does require investment, as we've seen from the government's underfunded healthcare homes have clearly demonstrated. Yet we need to eliminate waste and find ways to do things more efficiently across our healthcare system. But we also need to back reforms in primary care or anywhere else in the healthcare system with investment. I believe I've said this to you before, but it certainly bears repeating. We should reject the mantra that spending more on health and aged care is necessarily a bad thing. Yes, we need to always spend responsibly, but the idea that we should spend more on health and aged care as our population ages is not actually a bad thing. It's simply what is required to provide decent quality of life. Hospital funding is, of course, a case in point. As it's been noted, our current funding formula for our public hospitals is dooming them to failure. Before they were elected, the current government promised to honour Labor's historic 50-50 funding agreement with the states. Instead, they decided to tear it up. That means for the next funding period, out to 2025, the Liberals are nearly $3 billion shortchanging our public hospitals. That's why we've in fact announced that we will reverse these cuts with our 2.8 Better Hospitals Fund. It will pay for more activity in our public hospitals, more emergency department presentations, more elective surgery, bringing down waiting times. It will also pay for more resources, more beds, more doctors and, of course, more importantly, more nurses. It will also fund a range of capital projects, new hospitals, new and improved wards, and that means better facilities for those who work within them. So Labor is actually putting our money where our mouth is on this. We're also prepared to invest more money to address health inequality, something I know that also concerns all of you. Despite decades of economic growth, some Australians still don't have full equity when it comes to healthcare opportunities and to outcomes. This inequality remains most stark in relation to Aboriginal and Torres Strait Islander peoples, but socio-economic status and geography leave many others in our community behind as well. And by some measures, this has been getting worse, as we've seen an increasing focus on out-of-pocket costs when it comes to healthcare. Earlier this month, the Australian Institute of Health and Welfare finally laid bare the full extent of the health affordability crisis that's emerging in Australia. The report shows that Australia is spending nearly $30 billion in out-of-pocket health expenses each year, and that includes $3 billion a year on non-hospital Medicare subsidised services. Half of all patients have incurred out-of-pocket costs to see a GP or specialist or have blood tests, x-rays or other scans. 70% of patients seeing specialists made some out-of-pocket payment, and more than 1 million people spend $600 or more on medical gap fees. As a result of these soaring costs, 1.3 million people are either delaying or skipping seeing a healthcare professional entirely, putting their well-being and possibly even their lives at risk. Improving affordability will be a key focus for myself if we win the next election. Having touched on some of the broad areas of our vision and some of the systems issues, I want to turn to some of the debates and some of the position papers that the college has been pursuing. Some of them are really big, substantial issues, and some of them are smaller issues like the GST on tampons and sanitary products, but they're important ones. The first one I want to mention is the decriminalisation of abortion. We've been fighting that, and I'm very pleased that you are as well. I'm so proud of my Labor colleagues who are showing such great leadership on this issue here in Queensland, and I hope that in the very near future, Queensland will finally respect the right of women to choose. Hopefully New South Wales will soon follow suit. Of course, the law is not... Of course, the law is not the only barrier to termination access. Geography remains a significant barrier for many, and we must do more to improve access in regional and rural areas. If we've seen in Tasmania what happens when a Conservative government chooses not to fund services, forcing women to travel interstate to access safe terminations. It is a clearly unacceptable situation in 2018, and Tasmania is not the only area that this is occurring in. So we're committed to making sure we have a new sexual and reproductive health strategy, and that the issue around access to terminations forms part of that. On stillbirth too, we need to do more. Our stillbirth rate in Australia is still far too high, 30% higher than other developed nations. It does not have to be like this. The college has described stillbirth as a neglected epidemic, and I tend to agree. It's an issue that has been ignored for far too long and needs more focus and better investment. You may have noticed that the Federal Labor Party now has another fierce advocate for action within our ranks, and that's Christina Keneally from New South Wales. She's brought focus and momentum to this issue, and there is a Senate inquiry that she and Malandiri McCarthy are leading the charge on. It will be a very important part of our policy development process. The other one that's been a fairly hot topic of late has been my health record, and I know that it's one that the nursing profession cares very much about. I want to reiterate that we in Labor support digital health records. We think it is a fundamental and important healthcare reform. We do believe e-health has the potential to deliver enormous benefits to the community and to the health workforce. But for this reform to be successful, we have to take the public with us. They need to have faith in it, and they need to be assured that their privacy and the security of their data will be protected. And unfortunately, that faith has been severely damaged in recent months. The government has botched the rollout. Instead of being upfront with the Australian people and clearly explaining the benefits of the health records, helping them understand the benefits, they took a defensive and secretive approach, in my view, that fuelled scepticism and distrust. They tried to maximise the take-up rates by slipping the opt-out period out past the Australian people in a way that was not communicated on a mass spectrum, and certainly it's meant that people's confidence in the system was dented severely. Now they're of course scrambling to try and make it right, and they've announced some changes that we're currently examining, but they will need to do more, much more, to restore the public's faith and trust in that reform. It's also why we've initiated a Senate inquiry so we can untangle the mess that they've created. There's been issues raised from the community that works with people who are the victims of domestic violence and about what the electronic health record might mean there. Unions have been raising significant concerns with us that they believe need further protections in the legislation. All of those issues need to be dealt with seriously, and they need to be dealt with before the opt-out period continues, in our view. Another area I just briefly want to mention that I also thank you for campaigning so hard on is the Tampon Tax. It's an area that we agree very firmly with the college's view on. In April, I was very proud to join with Tanya Plibersek, who I understand addressed you last year, and Chris Bowen, to announce that if we're elected, that we will remove the tampon tax from the GST from tampons and sanitary products. It's a particularly significant development in the policy process across the board. We know that this is a tax that should never have been imposed in the first place, and it's one that should be removed. I think we've now seen the government follow suit, but we've heard that before. The issue always with the GST is finding the replacement revenue so that we don't see the states have a shortfall in GST revenue, which of course then affects their capacity to fund hospitals, schools and other essential services. I think that's really important when any of these GST debates come back. That replacement revenue is really significant. So I hope very much that the government follows through with that, but we'll wait and see. I again want to thank you for having me here today. I know that your position papers, whether it's from workforce development, whether it's chronic disease, whether it's end-of-life care, will be really significant in informing the views of the Labor Party as we go forward in the next 9 months to the federal election. I do want to say that Labor does have a very proud record when it comes to health policy, but we know that we cannot rest on that record. We introduced and developed Medicare, and we know we need to build on it. We believe deep in our hearts the fundamental principle that it represents about universal access to healthcare, but we know that that requires constant work if we're going to have a universal healthcare system in this nation. We know and understand that our health workforce, especially our nurses, must be part of that. So I'm looking forward to working with you, hopefully soon in a different capacity, to make that vision a reality. Thanks for having me here this morning.